Hello, my dear friends. It's always a pleasure to connect with you. Today, we're going to talk about something that touches many of our lives as we get older: our bone health. Specifically, we'll be looking at osteoporosis, a condition that, unfortunately, is quite common in seniors. You might know it as the brittle bone disease. It's a condition where our bones become weaker and more fragile. This means an increased risk of fractures, even from a minor fall or a simple bump. These fractures can significantly impact our quality of life, our independence, and our overall well-being. Now, we often think about diet and exercise for bone health, and those are incredibly important. But have you ever considered that some common medications, things we might take regularly for other conditions, could be quietly affecting our bone density? It's a topic not often discussed, but it's vital for us to be aware. So let's explore this together. We trust our medications to help us, and they often do wonderful things for our health. However, it's also true that some medicines, especially when used long-term, can have side effects we might not immediately link to them. Think of our medicine cabinets. They can hold remedies that, while treating one issue, might unintentionally be acting as bone killers, slowly weakening our skeletal structure. Let's shine a light on 4 common types of drugs that research and medical experience have shown can potentially decrease bone density. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 10. If you don't like it, comment number 0 to let me know so I can make a better video for you. Now, let's get started. First on our list are glucocorticoids, which you might know better as steroids. These are powerful anti-inflammatory drugs. Doctors prescribe them for a wide range of conditions, such as arthritis, asthma, autoimmune diseases, and severe allergies. While they can be lifesavers in managing these conditions, long-term use, especially at higher doses, can be tough on our bones. How do they do this? Well, these steroids can interfere with the body's natural bone-building process. They can reduce how well our bodies absorb calcium, which is a key building block for bones. They can also speed up the rate at which old bone is broken down and slow down the formation of new bone. It's a double whammy that can lead to significant bone loss over time. The second group we need to discuss are proton pump inhibitors, or PPIs for short. These are very commonly used medications for conditions like acid reflux, heartburn, GERD, gastroesophageal reflux disease, and stomach ulcers. You might recognize brand names like omeprazole or lansoprazole. They work by reducing the amount of acid your stomach produces, which brings relief to many. However, there's a growing understanding that long-term use of PPIs might be linked to an increased risk of fractures, particularly hip fractures. The thinking here is that stomach acid actually plays a role in helping our bodies absorb essential minerals, including calcium. If stomach acid is significantly reduced for a long period, it might mean less calcium is absorbed, and over years, this could contribute to weaker bones. I remember hearing about a gentleman, let's call him Mr. David, who had been taking medication for his persistent heartburn for many years. One day, he had a small stumble in his garden and ended up with a broken wrist. His doctor suspected that his long-term medication, while helping his stomach, might have played a part in his bones becoming more fragile. It's a good reminder to discuss long-term use with your doctor. Third, let's talk about certain types of insulin sensitizers, specifically a class of drugs called thiazolidinediones, or TZDs. These medications are used to treat type 2 diabetes. They help the body use insulin more effectively. While they are beneficial for blood sugar control, some studies have shown that certain TZDs can have a negative impact on bone density, particularly in women. The way they seem to affect bones is quite complex. It's thought that they might influence the cells in our bone marrow, encouraging them to turn into fat cells instead of bone-forming cells. This shift can lead to a decrease in bone mass and an increased risk of fractures. If you are taking medication for diabetes, this is definitely something worth discussing with your healthcare provider. And the fourth category we'll look at today are some anticoagulant medications, often called blood thinners. These drugs are vital for people at risk of blood clots, perhaps those who've had a stroke, a heart attack, or conditions like atrial fibrillation. Common examples include warfarin, you might know it as Coumadin, and heparin. While they are crucial for preventing dangerous clots, some anticoagulants can affect bone health. Warfarin, for instance, works by interfering with vitamin K. Vitamin K isn't just for blood clotting. It also plays an important role in bone metabolism and keeping bones strong. So, long-term use of warfarin might inadvertently weaken bones. Long-term use of heparin, another anticoagulant, has also been linked to bone loss in some studies, though the exact way it does this is still being researched. It's a delicate balance, as these medications are often life-saving, but awareness of potential bone effects is important. Now, hearing all this, you might wonder, how would I even know if my bone density is decreasing? It often happens silently, without obvious symptoms in the early stages. However, there are some signs that could indicate your bones are losing density and strength. One of the most common is persistent back pain, especially if it's a new or worsening pain. This can sometimes be caused by tiny fractures in the vertebrae of your spine. Another telltale sign can be a loss of height over time. If you notice you're getting shorter, it could be due to compression fractures in your spine. A stooped posture, sometimes called a dowager's hump, can also develop as vertebrae weaken and compress. And of course, the most obvious sign is a bone that breaks much more easily than you would expect, for example, from a minor fall, a cough, or even just bending over. If you notice any of these signs, it's really important to speak to your doctor. Don't just dismiss them as getting old. So if we are taking some of these medications, or if we're concerned about bone loss in general, what can we do? Is it all doom and gloom? Absolutely not. There's a lot we can do to actively combat bone loss and protect our precious skeletal health. First, let's talk about lifestyle adjustments. A balanced diet. Rich in calcium and vitamin D is fundamental. Think dairy products, leafy green vegetables, fortified foods, and safe sun exposure for vitamin D. Regular, gentle, weight-bearing exercise is also key. This doesn't mean you have to run marathons. Activities like walking, Tai Chi, gentle dancing, or light resistance exercises can help strengthen bones and improve balance, reducing fall risk. Avoiding smoking and limiting alcohol intake are also very beneficial for bone health. Secondly, regular checkups and, if your doctor recommends it, bone density scans, often called DEXA scans, are crucial. These scans can measure your bone mineral density and help assess your fracture risk. Early detection is key, and most importantly, if you are on any of the medications we discussed, or any long-term medication for that matter, have an open conversation with your doctor. Please, never stop or change your medication dosage on your own. This can be very dangerous. Instead, talk to your doctor about your concerns regarding bone health. Ask if your medications could be affecting your bones and what can be done. Sometimes your doctor might be able to adjust your medication, suggest a different type, or prescribe medication specifically to protect your bones if you're at high risk. They can also advise on the right calcium and vitamin D supplementation for you. So let's try to bring this all together. Our bones are the framework of our bodies, and protecting them is vital for an active and independent life in our later years. We've learned that osteoporosis is a significant health threat for us seniors, and we've uncovered that some commonly used medications, glucocorticoids, proton pump inhibitors, certain insulin sensitizers, and some anticoagulants, can, unfortunately, contribute to bone loss. But knowledge is our greatest ally. By being aware of these potential risks, by paying attention to our bodies for any warning signs, and by working closely with our doctors, we can take proactive steps. Protecting our bone health truly starts with paying attention to the details, including understanding our medications. I encourage you today to think about this information. If you have any concerns, please make an appointment to speak with your doctor. Let's all commit to being advocates for our own health, making informed choices, and taking positive actions to keep our bones strong and resilient. Thank you for listening. Dear friends, take care of yourselves and stay well.